Okay.
Thanks everybody for joining. All right, today we're going to go over just intro, a little bit about us. You meet the Revive team, and then we're actually going to be doing, or Michelle's going to be doing a live CoolSculpting treatment today. You'll learn everything you need to know about CoolSculpting with our CoolSculpting 101, and then how to get in touch with us, whether that's scheduling a consultation, getting more information about other services through our social media. And then we have special promotions for our viewers today. And then your Q&A are questions and answers, but please feel free to put stuff in the chat as we're going through it. I'll do my best to answer them as we go. All right, this beautiful young lady next to me is one of our Boss Babe master sculptors. Michelle began her career in her hometown in Ireland, so we have a real live leprechaun with us today. She attended the CoolSculpting University Master Program, and where she learned the most advanced techniques for treating patients. And you've been treating for how long now?
I've been treating here at Revive for about close to 10 years now. And so, I love CoolSculpting. I love the results. And, it's like, everybody has a different story when they come in for CoolSculpting. And it can be, just the tiniest little bit of subcutaneous fat to more than a little bit. And, we all go through different changes in our bodies, with hormones, just life. So CoolSculpting, I'm excited when you come in, do that first treatment, and I meet you. And then when you come back and I see the results for the second treatment, I get more excited, I think, than the clients. But love it, and I'll never quit. Love my job.
And every patient's so happy every time they're able to treat with Michelle, and she loves doing it, and I think that makes all the difference too.
And then this is Julie, as I'm going to introduce Julie, our lovely Julie. She's VP Revive, 12 years in aesthetics. It's a long time.
Yeah.
Licensed cosmetologist and has been in the beauty industry for 20 years now. Aesthetic specialist expert at Revive, and we love having Julie here. She knows everything about everything, and between the two of us, we know everything.
We've done everything.
Yeah, we have tried things, and so we are the right people to ask, does it work, does it not work? But we know what works, right, Julie?
Exactly. And we're no gatekeepers over here, so if you have questions on everything, let us know. But we do complimentary consultations with some of our other aesthetic specialists, and then complimentary consultations with Michelle here. And if you're able to, she's located here in our Carmel Valley, San Diego location. So if you're interested in doing CoolSculpting after this, definitely try to make it to our Carmel Valley location.
Yeah, absolutely.
So a little bit about us here at Revive Med Spas. We've actually been around since 2006. Our first location is in Mission Valley, still standing there. And we are the #1 providers in Botox, Juvederm, really all things Allergan, including CoolSculpting, as well as #1 in California for our Morpheus treatments. We have 8 convenient locations, 5 in SoCal, and then 3 in our Northern California.
That's amazing. I mean, you can go anywhere now and find a Revive.
And this is our medical team. So Dr. Vishal Verma, he's been there since the beginning. He's our co-founder, our medical director. We have Dr. Leif Rogers, who's located in Beverly Hills, as well as Megan Naud in our Northern California locations. Our medical team is dedicated to identifying suitable surgical and non-surgical options for each unique concern. We also pride ourselves in having multimodality treatments. That was something that Dr. Vishal Verma created, and that's something that's very special here at Revive. And we're constantly providing advanced training opportunities for our medical providers, so they have access to the latest technologies and techniques. And that's also what makes Revive so special, is the trainings that we offer with all our amazing providers. We're definitely led by leaders in the aesthetics field.
Our providers are amazing, though, aren't they?
Absolutely.
They're like super good, and they're so knowledgeable. They will answer every question you have. We really do have a really good team here.
We do, yeah. And I was a long time patient before even coming to Revive as an employee, so Revive definitely has a great reputation out there. All right,
so we're gonna start a treatment. So we have Julie's gonna move our computer around, and we will introduce you to our lovely model. So this is Maribel, and I'm going to have Maribel stand up. And Maribel has come to me this is going to be her second treatment for CoolSculpting. So we're going to do her abdomen area here today. So Maribel, well, the first time she came, it was you were nervous, weren't you, for Cool Sculpting?
I was very
And
nervous.
explained everything. And then by the time she's just sitting back and she's enjoying the treatment, where her abdomen was the area that she was concerned about. And Maribel, she travels all the time. So her next trip, we're going to Amsterdam, right?
Going to Amsterdam and the Rhine River.
Yeah. Rhine River. I feel like I go on these trips with her because they're amazing. She went, was it Bora Bora? That was your,
Last time I was here, we were going to
Bora Bora, and it was, I mean, I want to go to Bora Bora. It was fantastic, but she has certain little spots that, she just wants to, so she feels more confident, feels better in her dresses. So we're going to do her lower abdomen today, and later on then we'll do her upper as well. And that area just and also too, you said you have a lot of hormonal changes too.
Right. So it's been like almost a 2-year journey of losing weight, and I've lost like approximately 60 pounds.
Wow.
Yeah.
Congratulations.
Yeah, thank you. Through exercise and eating well, trying to eat well.
Yeah.
But this area right here is just stubborn.
Yeah.
And going through menopause, that doesn't help. So
Yeah.
My first treatment, I've been really happy with it.
Excellent.
Yes.
And when you, especially like for menopause, it's like you can't explain it. Those areas, they just come on your hips and they come on your abdomen. With the Cool Sculpting, it works so well because we are killing those fat cells permanently, and those fat cells are not going to come back. So we're going to set you up.
Okay.
We put you in here. So have you. I'll take that from you. Perfect. And we'll pop that in here. And when you're Cool Sculpting, you can, bring your iPad with you. I have movies here. We'll get you comfortable and you won't want to leave. Okay.
Congratulations on your weight loss too. I'm sure like combination with Cool Sculpting and weight loss.
Right. And I think one of the reasons I'm coming back is because I did see that result the first time. And it's been almost a year.
Right.
It's almost been a year, and it hasn't come back.
That's great.
That's
good. And it really is, when clients come in, I always tell them, you have to do it's diet and exercise, as well, because you're not going to lose weight when you Cool Sculpt. We're killing the fat cells, but you're not going to lose weight. So with your diet, with your exercise, it really does maintain really, really well. So when we're Cool Sculpting, we use I'm just going to put that like that so everybody sees. We're going to clean down the skin, and then we're going to put a pad on the skin, and the pad actually protects the skin. Now, people ask, who am I a candidate for Cool Sculpting? And that's why we have you come in and do a consult, and we can do a virtual consult if you need. But it's like if you have like an area, and people always say, what's subcutaneous fat? What is that? And like if you squeeze the fat on your stomach like that and it's kind of squishy, that's a subcutaneous fat, because a lot of the time people have visceral, and the visceral fat is that hard fat where it's like, it's super hard on the upper area. Then you're not a good candidate for Cool Sculpting. But if you have visceral on the top and you have subcutaneous on the flank area, then you can Cool Sculpt. So the pad is really, really sticky. It has a gel feeling, and that goes on the skin and it just protects. It's a little cool when it goes on. It's the coldest part, isn't it?
Yes.
Yeah. That part, everybody is like, ooh, that's cold. So the applicator we're going to use on Maribel, we have different applicators, and I'll go over all the applicators with everybody. So we're just going to go on the bottom like that, and it's just going to suck in like that. And that stays on for 35 minutes. So we'll just strap you in a little. Perfect. And then she's ready to Cool Sculpt. Now, if we were doing, another area, we can hook up the other area as well. But we'll just do one at a time, just so that everybody can see. So, how do you feel there?
Good.
Yeah. So You felt the suction
You
as
just
it
feel
went
like the
on and
suction
everything?
and then.
Yeah. So now I'm going to
Yeah.
turn it on. So what she's going to feel, she's going to feel a hot, cold, little bit of a pulling sensation. And that will be about, I've actually timed it, everybody, it's 7 minutes, and then it'll dissipate, and then you'll be nice and comfortable. Some people can feel it a little bit more, other people don't feel it, just kind of depends on your pain tolerance as well. I am a baby, so I know what that felt like, and it really is. It's the hot, cold, little bit of a stingy, and then goes away, and then you're quite comfortable, and it's quick. It's like 35 minutes. Perfect. And then we'll let Maribel here. She's gonna sit and just relax and go on her phone, and then we can talk about CoolSculpting.
All right. Well, Michelle's getting our model all situated. We're going to actually go over CoolSculpting, and she did give you a little brief intro about the treatment, but we're going to go in depth now. So what is CoolSculpting, Michelle?
So CoolSculpting, basically, it's a non-invasive, non-surgical treatment, and it's a way to contour your body by safely, effectively freezing stubborn fat away. Once that fat's gone, it's gone, and there is no downtime. That's the amazing thing about CoolSculpting, because CoolSculpting, you know, you can go to the gym, you can leave here, you can do anything. That's the great thing about the CoolSculpting.
And so you did mention before that with CoolSculpting, since it freezes the fat cells,
Yeah.
the fat cells don't return after that.
Yeah. Yeah.
Okay,
so your lymphatic system is going to flush them out. That's actually where the fat goes. They shrink. You know, I'll let you do it if you want to.
Well, I was going to ask too with fat cells. I know
Yeah.
at the age of adolescence, like our fat cells are there to stay, and as we
Yeah.
gain weight and lose weight,
Yeah.
no fat cells are actually going anywhere. But with CoolSculpting, you go in and
Yeah.
actually destroy them.
We actually kill them. We actually, I love saying it, but we murder those fat cells. An easy kind of way as well, if you kind of think about it, so we don't go into the scientific part of it, is like when you're losing weight, okay, you're on a diet, you're losing weight, your fat cells shrink, okay? You CoolSculpt, but those fat cells still stay there. They're still in your body, they're just smaller. You gain weight, they expand. So those fat cells are going to expand. You're back to where you started. When you CoolSculpt, we're actually going in and we're taking out certain 25% of those cells, and those cells were actually killing those cells. So those cells are gone. That fat's literally gone for your body. So that fat's not coming back. That's, I think, is an easier way to explain it.
Mm-hmm. And there are a lot of treatments out there that
Yeah.
help for shrinking of the fat cells, but don't necessarily destroy them. So
Yeah.
you know that when you're coming in, you are getting a permanent reduction
Yeah.
of overall
Yeah.
fat loss.
Yeah. Yeah, and we all have those stubborn spots that you can't get rid of.
Mm-hmm. Mm-hmm. Yeah, even when you're working out every day,
Yeah.
eating well, there's
Yeah.
always those areas that are kind of like
Yeah.
the first area that you gain weight
Yeah.
that you notice, or
Yeah.
the last area to lose the
Yeah,
weight. Those
absolutely. And you know what you can expect on treatment day, like we showed you with Maribel, you know, you're going to come in, we're going to set up a treatment plan. I like you to come in and have a consult, you know, beforehand, so we're all ready to know what we're going to treat. So we'll start, you know, a consult for you. We'll have all your treatment plan ready. Also too, you know, it might require a few sessions. You know, usually you'll come in and everybody's different. You could start off with one, somebody might need 2 or 3 sessions. Again, we'll get you changed. You're going to go into the bed. We're then going to, I'll then put the vacuum on. And like you saw with Maribel, it's pretty easy, you know, and it's the feeling again, if you're only just chiming in, it's a hot, cold, little bit of a stingy feeling for about 7 minutes. Then it, you know, dissipates, and then it's actually -11. So you're freezing at -11. But the funny thing is you cannot feel it. You just feel it on that one spot. The rest of your body is absolutely fine.
It's kind of similar to like icing.
Yeah,
injury,
cryotherapy.
Yeah, it hurts in the beginning as far as not hurts, but it's uncomfortable with being so cold, and then your body just goes down.
And you know, that's a good question actually, because cryotherapy, people do ask you, what's the difference between cryotherapy and CoolSculpting? Well, cryotherapy is like like if you've got muscle soreness, it really does help with muscle soreness, where CoolSculpting is getting rid of your fat cells. Have you tried cryotherapy?
I've tried both. I can't last
Yeah.
very long in there. I've done cold plunges though too.
Oh, cold, right?
Yeah, very.
Yeah, too cold. I like the heat.
Yeah. And then kind of what to expect after your treatment. Like I've done many treatments,
Yeah.
and during the actual treatment, it's really easy, just the like, little moments of being
Yeah.
uncomfortable with each applicator.
Yeah.
And then I've been sometimes tender to touch after,
Yeah.
but not
Yeah.
to the point where I can't do anything.
It just feels like you've done a really good workout. That's the feeling. You do get swollen. You will swell. You will think, oh my God, am I bigger than I was before? But it's actually swelling. Swelling's good because the swelling is what CoolSculpting really wants, because that's what's getting your lymphatic system to flush out all those bad boys. They're leaving your body.
Is there anything that they can do too, or patients can do to help like speed up their results?
No, it's going to be between 3 to 12 weeks are your result time. Usually around 6 weeks, you actually will see a change in your body. Some people are a little bit quicker. Other people can, they might wait a little bit longer. As long as you're just doing your, maintain your weight. Diet and exercise, I always say, is really, really important. That, just don't CoolSculpt, but also too, if you cannot exercise, your CoolSculpting, that is doing your work. But if you've got an injury or something, it does help you as well. But maintain your weight, and diet and exercise are the two things. And then also too, your follow-up appointment, that's important. I want you to come back. I want to see the results. I want to see what's happening.
And for follow-up appointments, typically how many rounds do patients need to do?
You'll come for your first treatment, and then I like you to come back. I usually do between 6 to 8 weeks, and then about, come back and you can do your second treatment.
Wonderful. Okay, maintaining results. Well, as you've already mentioned, the fat cells are gone, so they're not going to come back. But if you are fluctuating in weight, I would assume. But what are some things that patients can really do to maintain?
You follow a healthy diet, exercise regularly. I think everybody just loves exercising in San Diego. Receive, you'll get a follow-up appointment from the desk, and then also to just stay motivated. It's like you will I will have clients saying, I don't see anything yet, and it's only week 1. And then it's like all of a sudden I get a text and they're like, yay, I see it. So just keep motivated, and it does, your body will change.
Yeah, and that's very motivating. It's kind of like when you're working out, we don't see results day 1, but once you start seeing the results, it almost makes you
you
more excited to keep doing it, continue to keep working out, and continue to keep coming in for CoolSculpting.
Absolutely.
And it gets very addicting too, right? You do your stomach, and then you want to do something else.
You can move around your body, and we can tell you how many areas that you can do. And there are 9 areas of the body that you can CoolSculpt. And I think we have another slide on that we can show. Oh no, we don't. So I will tell you the 9 areas of your body before I go on to this slide, and then I'll repeat myself again at the end. You have your lower abdomen, upper abdomen, like all your stomach area. You have your flank area. And what are your flanks? Your flanks are like right there on your side area. And then you have the back area, which can be your back flanks. You have your bra roll. You have that little area that, we always call it the Lululemon bra. That's where it always sticks out. You can do your chin, and for your chin and your jowl area, which is nice, that's the only area that will tighten underneath that jowl area. But you do have to have that subcutaneous fat for underneath your chin. Again, outer thighs, inner thighs, banana roll behind. And the banana roll is that, where your bum is, and it's just right underneath your bum. It's like that little hammock area. And that gives you a nice sculpt to your bum as well when you do that area. And then your arms, you can do your arms as well, which is amazing. They didn't have that about 2 years ago. When they came out with that was fabulous. We
Mhm.
loved it. We have a before and after just to kind of show you like an idea. This is a lower and upper abdomen, and she came in and this is 2 sessions. And she did her lower, and you can see on one side of it, it is a little bit lower than the other side when she started. But we actually got it to, it looks fantastic on her.
It looks great.
Yeah,
Yeah.
on her second session. And you know, and our photos that we show you, these are all photos of clients that, you know, they're us, they're real people.
Mhm.
Yeah, that was a good one.
Nice.
Again, this is from lower and upper abdomen. You can see from the side, you can see how much of that subcutaneous area has gone. And then she started off with her stomach, and then we went on to her flank area. This is a lower and upper before. These are the before and after again. This is 2 sessions of her flank area. So at the back, as you can see, she wanted to be a little bit more smaller. But you can see how the flanks went in on the back area for her.
And the flanks are like kind of like love handle area for a lot of us, and then underneath that bra. And sometimes too, when you start treating, and I'm sure a lot of patients can understand this when they start doing almost filler too, is you start to see some symmetries, you know, and so sometimes you can actually help with symmetry and like doing another round to an area where you might have more.
And she actually we did her bra area, as you guys can see on that upper photo. This was the before. We did that bra area as well, and that's like the up, kind of like where your bra strap hits, that little bra area. So we did that area as well.
Yeah, looks really good. And help with symmetry as well.
So flanks are the number one. And you know, like we said, with hormonal changes in your body, the flank area seems to always be hit with that hormonal stage. And you know, when we're fluctuating in weight too, we seem to gain a lot there on our flank area. But that we did the flanks right there again, and that was actually 1 session. So she did pretty good. Yeah, she did pretty good on 1 session.
And that shows also too, like everybody's so different. Some people might need more sessions
totally
than others.
Different.
Like,
and
different areas of your body. Like for me, my inner thighs, I did 3 rounds. My arms, I did 1, and I was like very happy. So it really just depends on your body.
And you know, it's like, and it doesn't matter, like even if you're super small and you have like some subcutaneous fat, you could be that person that needs 2 or 3 sessions. It just depends on the body, really. Yeah. And then again, this is my client that I absolutely love, and I love showing her because she came on vacation and her daughter had a baby, and she came to stay in San Diego. And she came in and, you know, she didn't know anything about CoolSculpting. So we started her off when we did her flanks and her bra roll. And you can tell the difference. She has a tan. She stayed here for a couple of months and she got a tan, and then she went back to the snow. But she got great results. That was her bra roll and her back. Really nice. Yeah. Abdomen and flanks again. Okay. Now, this actually, men, you know, the guys treat loads of guys, and their areas are always like their abdomen area and their flank area. And when I talked about visceral fat, a lot of men have visceral fat on their upper abdomen area. It's that hard fat. The lower, though, they can CoolSculpt absolutely no problem because it's usually squishy, and the flank area. And he was so excited. So he was happy with this. That was a good one.
Really good.
Yeah, Sylvia, thank you. Banana roll. Do you remember we talked about the banana roll, and that's the one behind your bum area, and it actually gives your bum a nice little, you know how everybody wants their bum lifted, that gives you a nice little lift. That is 2 sessions of the banana roll, and I love it because sometimes when you're in jeans and your jeans hit you in a certain way, it kind of like curves into the back of your leg. So banana roll works very, very nice. And that was 2 sessions. You know, we were talking about the Julie, you were talking about the legs, like how you had to do 3 sessions on your inner thighs. I find inner thighs, outer thighs, and that area, they're harder areas. You do need quite a couple of sessions on those areas.
Yeah. Really good.
Oh, the jowl. Yeah.
And you
The
did
gel.
say, you mentioned the tightening too. So
Yeah.
I see a lot of that.
Yeah. Yeah.
There as
The
well.
gel area.
Mhm.
Yeah. Chins are always, you know, they're once you get that cool sculpting on the chin, it really does change your whole entire face. And again, when you do your chin, I always recommend at least do 2 to 3 sessions on your chin.
Mhm.
Come in, have it done, and then come back between 6 to 8 weeks for your second session, and then your third session. The chin feels like you ever eat an ice lolly and you got brain freeze?
Yes.
That's what it feels like for the first couple of minutes, and then again it'll
It
go
goes away.
away. Yeah. Yeah.
And some patients I do know they do sometimes one in the middle, maybe
Yeah.
sometimes 2
Yeah.
on each
Because
side.
we can treat bilateral, so you can do one and overlap in the center. So you can overlap in the center by 50%. So that's like, but you want to make sure you have that subcutaneous fat on the sides. And then other people will just do, if you have enough, we can do one in the center. It's always a little harder because you have to have that a lot of subcutaneous fat for that center one.
Makes sense. Wow.
Yeah. The chin again, this was a male patient. And you know, the guys get great results again. And that was treated bilateral. That was one on the right and one on the left. Yeah. That's
Really amazing.
yeah. And the guys get great results. Oh, here's that little area that I was telling you about. The Lulu little bra fat area. I don't care whatever. When you put on your sports bra, I feel like they make them smaller on purpose. So we
tube tops too, you know?
Yeah, like a tube top. That's a good one too. It gives you that little spot right there. And you're like, wait a sec, I don't have that spot, but it just pops out. This is a good spot to treat. And I have a little applicator that goes on. It's a small applicator. It fits that spot perfectly. And I get great results on those. Yeah, they're like really, really good spots. That was one session, but you came back again for another session because you know you do one, you want it nice and smooth.
Yeah, if she got that good of a result off one. Yeah.
These are our arms. Okay, so arms, I think when they came out with arms, it was great because there's really nothing for arms unless you do a surgery and then have a huge scar.
Yeah.
You know, and you know, so for the arms, we all get that kind of, you know, that when you wave your arm, we call it the wave. So we have different ways to treat the arms. You can do 2 applicators on the arm, or you can do 1 applicator on the arm.
And so 2 like on
overlapping,
side.
like your arm is like this, and we'll go 1, 2, or else if you just have that area right there, we'll just go right underneath. Again, that's a really nice area to treat. Again, I would really recommend doing at least 2 sessions on the arms.
And this patient did just 1 applicator?
Yeah, that was 1 applicator, and you can see, and she works out too. She does work out as well. And you know, there's certain movements that I always tell my clients to do when they do their arms, just with 5-pound weights, just to keep that area tight, because again, the CoolSculpting doesn't tighten the skin, you know, so you want to make sure that you're, you know, using, you know, little weights and doing a little routine just to keep that area tight. Again, this is before and after. As you can see how much of the subcutaneous fat has gone from her arm. That was a great one.
Did she do 2 applicators, or did she do 1?
She actually did 2 applicators. So we overlapped. We go out as far as just right below the elbow, and it's 2 applicators. There's one starting from the inner and then out to the underneath the elbow area, and it works really well. I like you to do the first session and then come in again. I kind of usually do 7 to 8 weeks there because I want to see what's you know, what the result you've had, and then I can go from there.
And it is really important too, like especially for, you know, patients to understand that when you come in for CoolSculpting and your assessment and who's doing your treatment is so important, because if you can't just put it on an applicator anywhere. Because what can happen if it's not put into an area where there's
you can get dented. There's a lot of things, you know, you have to be, you know, super careful when you're doing this. So that's why I always say, please go to people that have been doing CoolSculpting and they understand CoolSculpting, you know, and here at Revive, we have the most amazing providers that do CoolSculpting.
Perfect.
Oh, we have
Yes.
financing options.
Of course.
Yeah, which
Yeah.
is great.
So most of our patients take advantage of the financing options. We have a
Yeah.
few different lenders that we work with, and many of them, as long as you're approved, or many of them are at 0% for, depending on what your overall price, can be all the way up to 18 months.
Yeah, which really helps people, and you know, it's, you know, if you, you know, you can pay little as you go along, which works out great.
All right, perfect.
So we have a couple of little questions. Somebody said, is a price per session? You know, when you come in, we can, you know, and I can always give you a call if you want to talk about prices and everything. You pay for one session, yes, and it just depends on how many applicators you're using. And when we talk about applicators, it means like, you know, say you're doing your arm and you need 2 applicators, then that's how we would price it. Okay, what is that, Lindsay?
Is there anyone who shouldn't get CoolSculpting? Like, who would not be a candidate for CoolSculpting?
So if you suffer from, if you have hernia in the stomach. Now, if it's in the stomach, do not do CoolSculpting on your stomach. You can do CoolSculpting on your flank area, but not around the stomach area. You can do it on the rest of the areas. Again, you have 9 areas of the body you can do, but please don't do CoolSculpting if you've got hernia. Now, if you have Raynaud's in the fingers as well, and that's basically, you know, where your body can't deal with cold, you wouldn't be a good candidate. But I do, you know, I've had 1 or 2 people that have actually had that, and if your doctor says it's okay that you can go ahead and do it, then that's absolutely fine. But you know, if you have some medical, you know, issue, always clear it with your doctor. Absolutely. Yeah. Again.
Great question. And then, or is it good for most of everyone as long as you have that subcutaneous fat? And maybe we could explain a little bit about, you know, making sure they understand like what that fat is and what that feels
so
like.
The fat is, subcutaneous fat is like that squishy fat. So that's the fat that you want to have. Visceral is the hard fat. Visceral is like you can't even pinch that fat. There's
hard.
There's nothing. And we do, somebody said to have different applicators. We have, so, you know, I have a lot of applicators to treat different size bodies. And we have, like, you know, we have the bigger ones, we have the smaller ones. And even though if I'm using a smaller applicator, you're still getting that 25% pull. Everybody thinks when they see the small one, I want the bigger one, but it's actually fitting your body. Because, you know, you could be a petite body and then you could be a little bit bigger. So, you know, but you're still getting the same pull. It's -11. Somebody was asking about temperature. The temperature is -11, which is pretty cold. But again, you're not feeling it. Maribel's back there, and she's having a great time back there. She's on her phone and everything. And but you're only going to feel it in the spot where we've put the applicator, where it's cold. Again, if nobody, you know, over how many areas? 9 areas of the body: inner thighs, outer thighs. You're above the knees. We forgot about the knees. So you can do above the knee area as well. Okay, how long between sessions for, do we have? Okay, so between the sessions, you basically want to wait. I like 6 to 8 weeks. I feel like that, you know, some people will do 4 weeks. I like 6 weeks. You can if you want at 4 weeks, but 6 weeks, I can see what's happening. You know, there's a change. Then you're excited, and then you're like, it really motivates you when you see that. And then Cameron wanted to know, how many treatments can I have in one visit? You can actually, we can treat all day. My client yesterday had probably about 14. You can do, when you've got your abdomen on, I can hook up your inner thighs at the same time. You have your chin on, we can do abdomen together. We can do arms and abdomen. I mean, I can treat a lot. The longest one is the outer thigh. Outer thigh is, because it's a flat panel, it just takes longer to get colder on the outer thigh. So that takes about 1 hour and 15 minutes. But you can do your chin at the same time. You could do your arms at the same time.
You just can't do your other leg because you're kind of laying on one
Yeah,
side.
yeah, and
so.
I don't want you to be uncomfortable as
Yeah.
well. Lindsay, are there any major side effects afterwards? That's a great question, Lindsay. Okay, so you will get, sorry, as I kicked everything, you will get swelling. Swelling, like I said, is very important. We like swelling. Some people can bruise as well. So you'd have swelling and bruising if you're going to bruise. I think the bra roll back here, it's a sensitive area, so you do get a lot of bruising, you know, sometimes
from
back
the
there.
suction.
It's the
Yeah.
suction, yeah, yeah. And I tell people too, like the chin, if you're doing the chin, you may get bruising. So, you know, try and do it when you're not, you know, you got an event in a couple of days, you know. You should always do stuff when you're not like jumping on a plane, you know, do not jump on a plane the next day, but try and do things, you know, a couple of days beforehand.
Is there anything that they can do to prevent any kind of
Yeah.
side effects?
Well, you know, just make sure you're hydrated when you come in. Just have a little something like a snack or something. Don't take, I don't want you taking, you know, like ibuprofen because, you know, you just, you know, that'll cause more bruising. You can take Tylenol if you like afterwards. I like arnica gel as well. Arnica gel is great. If you can just get a tube of arnica gel afterwards, and just, even if you don't have bruising, it actually feels so good on the skin. It's a homeopathic gel, and it'll just, you know, help with swelling.
Can you take it orally too? Will that help?
Yeah. Yeah,
Okay.
you can take the oral tabs as well. And they're, you know, you can, you know, a lot of my clients will actually, they'll feel like they want to exercise. You know, it feels weird because you're numb. So you're going to be jumping up and down. You're going to feel the numbness. But I feel like it kind of, you just kind of, you get used to it, and then you feel good when you're exercising.
I know in the past there's been recommendations for like wearing compression things too.
Yeah.
Is that something that
You
recommend?
don't have to wear the compressions.
No.
You know, no, it's like they've now you know, they proved that the compressions, if you want to and it feels good by holding everything in, you can. It's not really going to do very much for you. Most of our workout clothes now have compression, like our, you know, so if you want to wear your workout clothes, you know, it's kind of nice. When you come to see me, come casual. Just don't wear anything tight, because I'm telling you, getting those jeans on afterwards it's a lot of work. And
because you're kind of sticky too.
you
from
are
the
so
gel.
sticky.
Yeah.
So I want you then, like, just go home, take a shower. Don't go any steam rooms, saunas, jacuzzis, you know, for about 24 hours. Thomas wanted to know, can you go in the sun after a session? I recommend that you don't go straight into the sun. Wait a couple of days, because I don't want you to get hyperpigmentation. Some people get hyperpigmentation. It is one of those rare side effects that can happen. You know, you just don't know whose skin it's going to affect. If it does dissipate. Takes a little while, but it will go away.
And you really, with since you're CoolSculpting and freezing those fat cells, how long does that process take? And that's kind of why you don't want to go in the heat right after.
Yeah. You just stay out of the heat. You don't want to you don't want to overheat. Just let that process do it. Katie wanted to know, is sauna okay? Absolutely, but not right after the CoolSculpt session. Just wait for the next day. You can then go in the sauna. Oh, that's a good one. Is it okay Katie wants to know, is it okay to have a tattoo on the abdomen? Absolutely. I treated a lot of people with tattoos. Now, the one tattoo that, which is strange, if it's a very pink, with that pink coloring in the tattoo, and it is really weird. It always happens, like if it's on the flank or the love handle, it's sometimes the applicator won't take. And they found it's something to do with the dye, that the machine can read it and it thinks there's something wrong with the skin, like it has, you know, because the Cool Elite machines are amazing. They detect if there's anything wrong, if you're sometimes, like if you're overheating, if you're too cold, it'll detect and it'll shut off. So it's extremely safe. They're the newest machines. They've been out now for 2 years. They're fantastic. They're with all new applicators. They treat the body with all different areas, and they're a little bit smaller, so they treat really, really nice. We can sculpt really nice with those applicators. Again, there's a lot of different applicators that will treat. That was a good question about the tattoo, though. Thanks, Katie. We
Yeah,
like that
Katie.
question. Yeah, keep sending in questions. We love getting questions. We'll check in with Maribel and see how she's doing. And she's got 5 minutes left. How are we doing back there? We're doing good. Yeah. She doesn't feel anything. And so whoever's coming in today, the new episode of You is out on Netflix. so we're excited. The great thing about my clients are I get to find out what's new on Netflix. So I'm always up to date on Netflix. But let's see what we'll have some more questions.
Yeah, any last minute questions for anybody?
We have a question. How much time does it take? Okay, each applicator is 35 minutes. So the 35-minute applicators that will be like, they'll treat your abdomen, lower and upper, your flank area, your bra roll, and your arms, and then inner thighs. The one that's an hour and 15 is the outer thigh area, and then your chin area is 45 minutes. Cameron, we have another question
On the
here.
day of the consultation, can I start my first treatment?
You know what? You can. You absolutely can, as long as I need to know I have enough time and everything. Absolutely. And also too, you guys, I can do virtuals too. If anybody wants a virtual and you can't come in, I know everybody is like,
yeah, we offer virtual consultations. Absolutely. You can also send in photos. So you can get assessed before you actually come in. So that way on the day that you come in to any Revive location, you can get your treatment done.
And even sending photos in are amazing. So we have the most amazing consultants. They're fabulous. They will every client that they have brought into my room, they have done amazing work on what areas I need to treat and everything. And you can send photos into them and they will have a look, and they always run it by me and everything. And we'll put you on the right treatment plan. Consultations take 15 minutes, 10 to 15 minutes. I've done consultations with people in the grocery store, and they're by the freezer section, by the way, and in the car. The car is always the best, and the kids are all in the back. And so we get to know everybody. But again, someone's asking, yes, we treat the arm area. That's a really, really nice area. And then again, another question about the knees. The knee, when you're treating the knee, if you can think of the top of your knee, we want to treat over the top of the knee. Sometimes you get that little area of subcutaneous fat over the knee. That's a great area to treat. And you can treat, we'll treat the two knees, and then we'll, again, it'll another 35 minutes for the other two sessions. Ooh, I hear something's happening back there. We're
less than 3 minutes.
Yeah, we're nearly up again.
Like Bella shape, does your body absorb some of the extra fat and eliminate it through defecation? Is
the side effect to expected CoolSculpting? Yeah, no, that's great. You actually pee it out. Your lymphatic system, so it's going through your lymphatic system. Yeah, you're just peeing it out. You don't see it because it takes that 3 to 12 weeks. Again, 3 to 12 weeks for you to see results.
And does Bella shape eliminate fat?
No.
I don't think Bella shape is more of one of those treatments that can help for cellulite, but more shrinking of the fat cells. So again, if you fluctuate at all in weight, it just comes right back again.
What about inside the knee area? Inside the knee area, you have to be super careful because you've got a lot of, little blood vessels and everything going along there. It just depends. I'd have to see just a photo just to see what I would be treating. So Sylvia, if you want to, always get in contact with us, send in a photo. I can take a look for you. Again, lymphatic system is what flushes everything out. I'm just going to take a peek here. We're down to 1 minute 41 seconds. So it goes super quick when you're in here, and it's you're comfortable and everything. Now when Maribel leaves, she'll just, again, she can go to the gym. I think she's going to go to Pilates after this. And then, again, we have, do you want to talk about our social media?
So if you haven't already been following us, we have an Instagram. This is our Instagram handle, as well as TikTok, our amazing Yelp with all our incredible reviews from our happy patients. And then this along with other virtual events that we've had, are all on our YouTube channel. You can check out, we've done one on our laser and our multi-modalities that I had mentioned previously, all our regenerative treatments, and then this one will be posted within the next like 3 to 5 days or so.
So if you guys want to come and watch us, we'll take it off so you can just see what it looks like.
Yeah, we appreciate everybody being on. If you want to stay on, you can watch how the applicator comes off.
Perfect. So we're just going to pull it off like that. And again, it doesn't leave that, you know, years ago it used to leave you with this big lump and everything, but look how nice that is. It just comes off really, really nice. And then I'm just gonna massage her for about 2 minutes. And then what that does, it just smooths out the area. And any of those little fat cells that have escaped and they're on the out edges, I'm just gonna manually kill them. We love having you come to our CoolSculpt event. Love to see all your faces, and then I will answer more questions. If you still want to send questions, we would love to answer. Thanks again to Julie for hosting us. Thanks again to Maribel for being such a lovely model for us. And we will love to see everybody again soon. Thank you.